Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Welcome to another episode of the Medical Collective with your host, yours truly, Dr. Keisha Davis, pathologist, personal trainer, and podcaster. I love the Medical Collective. I love every time you join me and listen in to our conversations. And we are going to talk about measles today. Yes, we are. But we're going to speak about it not necessarily from immunization, but from a standpoint as a pathologist about what we are actually seeing under the microscope and why it's so important to prevent measles. I haven't had anyone that I know personally experience measles, and I don't want you or your family as well. So that's why I think it's important that we have this conversation today with it. And just for some context, we are now in a new year. It's 2026. Wherever you may be, these are timely episodes, but just to give context, the CDC has reported well over just this year, and we're not into February yet, in less than a month, over 400 cases of measles, over 400 cases. We unfortunately, because in 2000, we had reported that we had basically gotten rid of outbreaks of measles, that we may now be heading towards losing our elimination status. Canada lost their elimination status for measles. The United Kingdom just reported the other day that they have lost their elimination status, and now we could be number 3. This is why you need to open your eyes and understand it. So come join me under the microscope in understanding measles. I think people hear measles and think it's a mild childhood illness, but I want to explain to you what I see under the microscope and how it can, this virus, this sneaky microscopic virus can injure your organs and in real time damage the immune system and the memory for many years to come. I want to break this down, and I want to start with what measles, the virus, is. It is an airborne, highly contagious, one of the most contagious viruses. If you have measles and you're in a room with 10 people that are not vaccinated, 9 of those people can get measles from you. And it likes to linger. For some reason, this is a virus that can linger on surfaces. And imagine on a plane when someone has measles and why we have to do contact tracing. That one person that has measles in a plane can affect many and the next group of people that come on as well. So I want you to take that into account. Yes, when you first get it, you may have the fever, the cough, what we say, the prodrome phase, mild symptoms, and people knock it off as just a common cold, nothing big. That still is an infectious period for you. And then it is later when you develop more severe symptoms, if you do, that you realize, oh no, now I have measles, but it's too late. You may have already exposed many people to it. I want you to understand from a pathology standpoint that this virus can damage organs. Viruses go into your cell and wreak havoc. And I want to understand also that viruses can cause your immune system, that your fighting cells, to wreak havoc, and that damage as well can harm you. So even though your immune cells mean well, they could still damage you. So let's talk about the acute infection and what's happening. You get measles, you don't have the cough anymore, now you have severe respiratory infection. Hospitalization happens where 1 in 5 people that are unvaccinated in the United States will end up hospitalized. That's pretty severe. That is pretty severe. Pneumonia, those who have measles infection, it's a virus. It likes to go into the cells that line your respiratory system. That 1 in 20 children will develop a pneumonia, and that's the most common cause of measles death in children is pneumonia. Now, you may ask, well, what type of pneumonia? Viral pneumonia can be severe in itself, But you also, because now there's inflammation, there's fluid going around, bacteria can also set in, and it could be a secondary bacterial infection. Another acute cause is that the measles virus goes into cells, including cells of different organs like the brain, and cause encephalitis. Have you heard of that? That's inflammation of the brain, encephalitis. 1 in 1,000 people that get measles can develop encephalitis, which can cause seizures, mental status changes, intellectual disability, and deafness, just because of the measles. And then the most severe thing, of course, is death. So 1 to 3 in 1,000 children die from measles, and usually respiratory complications, as I mentioned, or neurological complications. Some of the damage is direct viral injury, as I mentioned, and some of it is more severe because of the immune response that your body puts on. And therefore, because you have an immune response, you can get secondary infections too. I want to talk about the next thing, which is kind of how this happens. The virus goes into your cell. It's kind of like, do you remember Goldilocks? It reminds me of Goldilocks, but she didn't really wreak havoc, going into a house and taking over. Well, the virus goes into your cell and takes over your cell and causes cell death of your cells. Not all viruses like all cells. If you remember, and please go back to the HPV, Beyond Cervical Cancer episode, where I explain what HPV does. And they like squamous cells. So they like to go to linings of the mouth, the cervix, the vagina, the penile and anal area. That's what they like. Well, the measles has their predilection and the types of houses they like to go to and take over. And that includes the respiratory system, that includes the neurological system. And that's why we see changes in those parts of the body because of this virus. It goes into your cell and takes over your cell. And like a bacteria, where bacteria is a cell by itself, it goes next door, maybe in the neighborhood, and crowds you out and causes problems, if that makes sense. So viruses like to do intracellular damage, and we see that under the microscope, which I will speak about in a minute. One of the things that measles does that people don't know about is, yes, it goes in and causes damage like COVID does, like SARS-CoV-2 virus does, but it also is tricky. It's one of those mind game destructors that it can make you forget what you knew. And when that comes to an immune system, that is very vital and that can be problematic. It causes an immune-amnesia, and I'm going to talk about that. It is amnestic. It's an immune-amnesia. And basically, when you get a vaccination, your immune system remembers that. And some vaccinations are lifelong for the most part, right? Like MMR. Some, like flu, we have to get every year. And that's because the virus changes more. And I'll explain that in a minute. When you get measles, even the vaccines you had for other diseases, measles virus has changed your immune system memory to where it forgets it. So what we're really now worried about is not the fact, yeah, you had measles and got over it, but now you may not even be immune to all the vaccinations and all the diseases you've been exposed to over time because your immune system has forgotten it. It wiped it clean. I mean, I don't know what show I can think of that can remind you of, but it's one of those sci-fi movies where you forget who you are. You had an accident or something, you come back and you don't know who you are or where you're around. So just be mindful of that. It causes immune amnesia. Tell your friends you learned that. It causes immune amnesia. That's why we need to be concerned. I think when we understand what these viruses do more in context, now we're like, now I see why they're trying to protect us and want us immunized and why our children need to be immunized against this. It's like deleting your saved passwords on the computer. How about that? And I have a lot of them. I used to brag about my memory, but I mean, it's the honest truth. As you get older, you do start to forget things. And if I were to lose all my saved passwords and not have an ability to recover them, I don't know what I would do. It's just literally like that. All of this stuff you rely on your saved passwords. That's what's happening to your immune system. Measles is getting rid of that. It replaces or reshapes basically the population of immune cells that you have, and it takes time to recover it. So just like you may forget your passcodes, you can recover them, but the time that is lost, and in that time that is lost to regain it, a lot can happen. Studies show measles infection can reduce pre-existing antibody diversity. So let me explain that. When you get an infection or even you get immunized, the response is different in that you have your B cells will produce antibodies, but they'll go to different parts of it. So part of your immune system may go against the head, right? And the other part will go against the arms because the bad guy has multiple ways of attacking you. So it's good to have what we call a polyclonal response to an infection. The measles can reshape that. And basically, the studies have shown that your diversity of your antibodies is substantially decreased. And they said they've seen ranges that after measles infection, your antibody diversity can decrease by 11 to 73%. And this was a Harvard research study that showed this. Mind-blowing, I know. So if immuneamnesia is the slow burn, then there is something else that I need to tell you that measles can do, and it's called SSPE. Make a little mnemonic off of that, SSPE. Really cute, but it stands for subacute sclerosing panencephalitis. Subacute sclerosing panencephalitis. If you have not been listening in the news, very, very sad. Towards the end of last year, in 2025, we heard the story of a child that many years after getting measles infection early on in life, resolved that infection, died from subacute sclerosing panencephalitis. And can you imagine your child gets better from an illness, you think you're out of the clear. And then later on, they start to have mental status changes, and you find out it's due to measles. That's what happened in this case. And we see in quite a few cases. It usually happens 7 to 10 years. 7 to 10 years after the initial infection. The CDC has estimated that there's about 7 to 11 per 100,000 measles cases that were at risk for SSPE. And they believe the risk is higher if you're infected before age 2. And I think that child actually did get their first infection before age 2. And again, don't forget, I'm talking about people that were not immunized too. You do know also that babies are very, very precious because there are certain vaccines they can get early on, which we recommend, right? The first one is should you get at birth, hepatitis B, but MMR, they wait. So you have to remember that they have a period where they need to be protected, where parents, you need to decide who and what you're going to have your child around. And especially now as more people don't want to get vaccinated, your baby is very susceptible to getting a severe infection. And even if they get better after that acute infection, later down the line, 7 to 10 years later, they could get this SSPE, which is subacute sclerosing panencephalitis. There were also the child that I was talking about and others are not common, but we should not make this a common conversation. I want to preface that. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. Now, I want to zoom out when we're talking about the SSPE and go into the different types of viruses. There are RNA viruses and DNA viruses. And within that, we even categorize it based on if they're single-stranded or double-stranded. And DNA stands for deoxyribonucleic acid. And then there's RNA, which is ribonucleic acid. The difference between the two and how they present infections is multifocal, but just to simplify it a little bit, DNA viruses, some HPV that we talked about, human papillomavirus, the one that's also of a big thing as we're January Cervical Cancer Awareness Month, and I talked about it in a previous episode. That is a DNA virus, and it's more stable. The RNA viruses we're talking about right now, which is the measles virus, and also don't forget another RNA virus, which is SARS-CoV-2 as well. A general point about them is RNA viruses, they don't need to integrate to cause long-term harm. They mutate more often, which is why we see sometimes we have to update some of the vaccinations. And inflammation, the reactive response can be long-lasting. And you remember, HPV is the one virus that directly causes cancer. We go over to some of the DNA viruses, such as HPV. They have long-term effects due to the integration. They integrate into your DNA, which viruses can do in general, but when they integrate into your DNA, they can induce cancer pathways, or they're called oncogenic cancer causing. And really just to go back even more, when you say, well, what's the difference? Why are some single-stranded? Well, it's human. It's human nature. It's the way things are. But single-stranded and double-strand is more about how the viruses replicate. And what matters clinically is what tissues they target and what the immune system does in response. That's what we really need to know is, well, we know HPV likes the squamous mucosa, likes the cervix, likes the oral mucosa, likes the anal mucosa. And we know the measles virus likes the respiratory system and can also go into the brain and other parts of the body. And I want to get now to the public health piece and about this elimination status, because as these viruses do what they do, what public health has done is that they have, since the 1990 and the 2000s, from 1990 to 2000s, as we saw more cases, is that they did an amazing thing. Through pushing out the vaccine campaigns, is they decreased to where we were basically not having an outbreak or an epidemic of measles virus. And now from 2000 to what are we, 2000 and 2026? Wow. 26 years we have been protected, where we didn't hear every day like what's happening in the Carolinas, what's happening in Texas. We didn't hear about all these outbreaks. Now we are on the verge of losing elimination status. That means losing elimination status or having elimination status means that there has been no continuous endemic transmission for 12 plus months. Okay. Now, what they're going to do is, it's already past January, right? Or we're towards the end of January. So now what happens is that scientists look at and determine, okay, for this past year, and you remember during the summer when it started in Texas, how many cases have we had? How is it spreading? Is this considered now endemic? Have we had continuous endemic transmission for the last 12 months? And when they see it for the last 12 months continuously, so maybe another spring or so, then they can say, okay, this has been determined by all the statistics and the data we have. Now we can say that the United States has lost elimination status, like Canada, like UK, as I mentioned before. And why losing it matters, I want to explain to you guys something about public health, is that we live in cocoons sometimes and we don't know what's happening beyond our house, beyond our family, beyond the little subset we have. And that there are people every day that are trying to make it. There are physicians, nurses, healthcare workers that are trying to keep things under control so they can focus on other things. It's kind of like if you were in the kitchen, it would be nice to have someone watching your toddler or baby so that you can focus on the cooking. But if you maybe had 3 babies running around, you're going to lose focus off the cooking and something may burn or there may be a fire. And when public health is when we keep putting out fires, but the fires come back, we can't focus on the cooking or what we need to do or have somebody focus on the baby because we have so many things that keep coming back up. And that's why I say when we saw how many people were unaliving, and you heard the statistics, how many people were getting sick, children that got respiratory illnesses or encephalitis and died. And now we put that fire out. And now 26 years later, we're seeing the fire come back. It's devastating to healthcare, the cost, thousands of dollars per person that has measles, that goes to the economy, that goes against the economy and affects us, the time, the care, the concern. And don't forget the most precious thing of all, the life lost, the child that was lost due to the decisions of a parent not to vaccinate. All of those things we have to put into account and be concerned about. The UK recently lost theirs. They put that announcement out, WHO did. As I mentioned, Canada as well. As far as us, the PAHO has scheduled a review of the measles elimination status, and Mexico's as well, in April 2026. So coming up, as I mentioned, in the spring, we will see the evaluation to see. The public health teams, and what they do is they look at chains of transmission over time. They look at lab genetic links between cases, right, to see if it was something else, and whether the same strain is spreading continuously as well. Because do mind, we just don't say measles. We actually do testing to see which strain it is of measles, right? Is it from the same family, or are they neighbors? So what do you do with this information that I'm giving you today? That should be your question. Like, okay, Dr. Keisha, we've got this. Measles can go into your lung cells. It can, damage your DNA. It can cause your cell death of your cells that are supposed to function. Remember, you need lung tissue so you can take in oxygen, have an oxygen exchange, and go throughout the body and have and be well. But if your lung tissue is damaged, right? Because there is something called a cytopathic effect I did not mention, is that how we are able to see it under the microscope is it goes into the cell, and we see a viral cytopathic effect where your cell now looks multinucleated. We call them these multinucleated cells, the Worth and Finkeldy cells. And we can see the destruction of it. Imagine in the brain where you get swelling, right? So first of all, not only does it cause the cells, some of the vital cells you need in the brain to die, that the inflammation and the swelling there's not much space in the brain. So swelling doesn't do well in the brain. And you've heard of people having increased ICP or increased intracranial pressure and unaliving, just stop breathing because of that. So we understand all of this. We understand what it does to the brain. We understand what it does to the lung, is that we now need to recognize the importance of preventing it. And unfortunately, viruses are out there. It's just like ants and mosquitoes, right? But we have people spray. We need to get our immune system ready. And I did not forget to mention to you all, not just the late-term sequela, but it causes amnesia of your immune system. So we're going to have more fires to put out. So now that you understand what it does, take that knowledge and share it with somebody else. It can damage your lungs and brain in the acute phase. It can weaken your immune memory, so making future infections from other diseases, not just measles, more likely. And it can cause long-term complications. Share the story of the child that died from subacute sclerosing panencephalitis, SSPE. And that vaccination isn't just protecting you, it's protecting your community. Remember I said about the plane? You go into a plane, you have measles, you doing good because remember, you're healthy, you're blessed, but the person next to you may not be so blessed, and you've left a mark on them for life and you don't even know it. That's what we need to think about. So I hope that this episode allows you to think about measles differently. Share it with a parent, a friend, while you're laughing or thinking about your plans for the spring. Because I've got them. My birthday, I have a monumental birthday coming up. I'm thinking about those plans. But you know what I also talk about? I talk about these topics. They're not, if we want to call them political, they are, but they should not be divisive. It's science. So the next time someone thinks that measles is harmless, share this. If you want a personal perspective on life and anxiety, go back to I started to get chest pain every day. I want to also you guys to listen to the episode on HPV beyond cervical cancer, but the reason why I want you to listen to I started to get chest pain every day is because when we don't protect ourselves and these outbreaks happen, the healthcare professionals that are stressed, that are losing their lives, that are trying to fight for justice, you're compounding their stress and anxiety. And one of the things I don't want you all to see is more of us leaving or more of us giving up hope or not being able to do our job effectively because we're so stressed. So if you can do the little things that you think, oh, but I'm healthy, but I could carry something on my back that can go off and hurt someone else or unalive them, then do it. And listen to the episode and think about that with an open mind. When you hear the stories of doctors struggling, getting migraines, dealing with health things, afraid of what's going to happen to them because, they're villainizing healthcare workers, think about that while you are sitting there deciding if your child's going to get their MMR and their other vaccination. So I hope this helped you. Everybody enjoy. Have a great day, evening, wherever you are, and stay tuned to the Medical Collective. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.